Before you try another throat spray, another lozenge, another home remedy, or another glass of warm water, I want you to do something right now. Swallow once, just once, and notice what you feel at the back of your throat. Is there a thick coating sitting there? Does it feel like mucus is stuck behind your throat no matter how many times you clear it? Do you wake up in the morning needing to cough, spit, sip water, or clear your voice before you can even speak normally? Now here is the part most people miss. If this has been happening for weeks, months, or years, it is probably not random. It is not just getting older. And it is not always because you need to drink more water. Your body does not usually create persistent symptoms for no reason. When mucus keeps collecting in the back of the throat, your body is often trying to protect itself from something. The real question is this: what is irritating your throat every day? What is making your body produce thicker mucus? And why does it keep coming back even after you try remedies that should have helped? I am Dr. Arthur Mark, and in this video, I am going to walk you through 5 common reasons adults over 55 develop persistent throat mucus, constant throat clearing, morning phlegm, post-nasal drip, and that annoying feeling that something is always stuck in the throat. And I am going to show you something very important. In many people, this problem is not caused by just one thing. 2 or 3 causes often stack together. Silent reflux may irritate the throat at night. Sinus drainage may drip down the back of the throat during the day. Dehydration may make the mucus thicker. And certain medications may make the throat feel even more irritated. That is why one simple remedy often fails, because the real problem may be a combination. Before I get into the first cause, do me a quick favor. If you want more videos that explain what your body is doing and how to support the root of the problem instead of just chasing symptoms, hit subscribe, give this video a like, and leave me a comment telling me this. Is your throat mucus worse in the morning, worse at night, or does it stay with you all day? Just write morning, night, or all day in the comments. I read those comments, and they help me know what senior health topics to explain next. So let us get into it. First, you need to understand one thing. Mucus itself is not bad. Your body produces mucus every day, and that is normal. Mucus protects your airways. It traps dust, bacteria, viruses, smoke, pollen, and other irritants before they can travel deeper into the lungs. It keeps the delicate lining of the throat moist. It protects tissue from drying out and cracking. So mucus is not the enemy. The problem begins when mucus becomes too thick, too sticky, too much, or too slow to clear. Inside your nose, throat, and airways, there are tiny hair-like structures called cilia. Their job is to move mucus along, almost like a cleaning system. When this system works well, mucus does its job and moves out without you thinking about it. But as we get older, this clearance system can slow down. Mucus may sit longer, it may thicken faster, and if something is irritating the throat, the body may produce even more mucus to protect the tissue. That is why a younger person may clear mucus quickly, while someone over 55 or 60 may feel it collecting for hours. This is not your imagination, it is biology. And once you understand that, the next question becomes, what is triggering the mucus in the first place? Cause number 1 is silent reflux. This is one of the most missed causes of constant throat mucus in adults over 55. Most people know acid reflux as heartburn. They think of burning in the chest, sour taste, burping, or stomach discomfort. But silent reflux is different. Silent reflux can happen without obvious heartburn. Acid or digestive fluid can travel upward from the stomach and reach the throat, voice box, or back of the nose. And when that happens, the throat reacts like it is under attack. The tissue in your throat is not built to handle acid. Even a small amount of irritation can cause the body to produce thick mucus as a protective coating. That is why many people wake up in the morning with mucus sitting in the back of the throat, even though they did not feel heartburn during the night. They think the problem is their nose. They think it is allergies. They think they need cough drops. But the source may actually be the stomach. Ask yourself these questions. Is your mucus worse when you wake up? Do you clear your throat more after lying down? Does your voice sound rough in the morning? Do you cough after meals or when bending forward? Do spicy foods, fried foods, chocolate, late dinners, or heavy meals make it worse? If yes, silent reflux may be part of your problem. And here is the important part. Silent reflux and post-nasal drip often work together. Acid irritates the throat becomes more sensitive, and then even normal sinus drainage feels much worse. This is why people say, "I feel mucus, but nothing comes out," or "I keep clearing my throat, but it never feels clean." The throat is irritated, the body keeps coating it, and you stay stuck in the cycle. Another thing to know is that some pain medicines, especially anti-inflammatory medications like ibuprofen or naproxen, may irritate the stomach or worsen reflux in some people. If you take these regularly for arthritis, back pain, knee pain, or headaches, and your throat symptoms have been getting worse, ask your doctor whether there may be a connection. Do not stop medication on your own. Just ask the right question. Cause number 2 is post-nasal drip from chronic sinus inflammation. When people hear sinus problem, they imagine a blocked nose, facial pain, pressure, infection, or a terrible headache. But in older adults, sinus inflammation can be quieter than that. You may breathe almost normally. You may not have a fever. You may not feel very sick. But the lining inside your nose and sinuses may still be inflamed enough to produce extra mucus. That mucus drains backward. Not out the front of the nose, down the back of the throat. That is post-nasal drip, and it can make you clear your throat again and again all day long. This is especially common when the air is dry, when allergies are present, when dust or smoke irritates the nose, or when the natural mucus-clearing system slows with age. Many people try antihistamines because they assume it is allergies. Sometimes that helps, but sometimes it dries the mucus and makes it thicker, stickier, and harder to clear. Then the person feels even more uncomfortable. This is why the solution is not always dry it up. Sometimes the better strategy is to help the nose and sinuses clear properly. One of the simplest options many ear, nose, and throat doctors recommend is saline nasal rinsing. A warm saline rinse can help wash away irritants, thin mucus, reduce drainage, and support the natural clearance system. But it has to be done safely. Use distilled water, sterile water, or water that has been boiled and cooled. Do not use plain tap water directly. Use the proper salt packet or a safe saline mixture, and keep the device clean. Consistency matters. Doing it one time and saying it did not work is not a fair test. Many people need daily use for 1 or 2 weeks before they notice the real difference. If you feel mucus dripping down the back of your throat, if you sniff often, if your throat feels coated after being outside, around dust, or in dry air, post-nasal drip may be a major part of the story. And if this sounds like you, comment sinus below. That tells me many of you may need a full video on post-nasal drip after 55, because number 3 is medication-related throat irritation. This one surprises people because they rarely connect throat symptoms with medications, but some medications can cause a persistent cough, throat irritation, or an urge to clear the throat. One well-known example is a class of blood pressure medications called ACE inhibitors. These medications can be very useful and are prescribed for important reasons, but in some people, they can lead to a dry cough or throat irritation. The tricky part is that this side effect may not appear immediately. It can develop weeks or even months after starting the medication. So a person may begin a blood pressure pill in January, start throat clearing in March, and never connect the two. They blame age, they blame mucus, they blame weather, they blame allergies. but the timing may tell a different story. Again, this does not mean blood pressure medicine is bad. High blood pressure itself can damage the heart, brain, kidneys, and blood vessels. Medication may be necessary and protective. The danger is not the medication. The danger is never reviewing it. If your throat symptoms began after starting or changing a medication, write down the timeline. When did the mucus begin? When did the cough start? When did the dose change? Did anything else change around the same time? Then bring that timeline to your doctor or pharmacist. Ask directly, could any of my medications be contributing to throat clearing, cough, dryness, or mucus? That one question can save months of guessing. And please hear me clearly. Do not stop blood pressure medication on your own. Some medications must be continued, changed slowly, or replaced carefully. Your doctor may have options, but the conversation needs to happen safely. Before I move to the next cause, do me one more quick favor. If this video is helping you understand your body instead of just chasing throat remedies, like the video and subscribe to Dr. Arthur Mark. And in the comments, tell me which one sounds most like you so far. Reflux, sinus, or medication. Just write one word. Your answer helps me know what to explain next. Cause number 4 is chronic mild dehydration. This sounds too simple, but it is one of the biggest reasons mucus becomes thick and sticky. Mucus is mostly water. When your body is well hydrated, mucus is usually thinner and easier to move. When you are dehydrated, mucus becomes thicker, stickier, and more difficult to clear. Think about syrup. When it is warm and fluid, it pours easily. When it sits and thickens, it moves slowly and sticks to everything. Mucus can behave the same way. Now here is why this matters more after 55 or 60. As people get older, the thirst signal may become less reliable. You may not feel thirsty even when your body needs fluid. Some seniors drink less because they do not want to urinate often. Some avoid water before leaving home. Some drink coffee or tea all day, but very little plain water. Some take medications that affect fluid balance, so the body runs slightly dry day after day. Not enough to create an emergency, but enough to make mucus thick, the mouth dry, the throat irritated, constipation worse, and morning mucus harder to clear. This is also why people wake up with thick mucus after sleeping all night. During the night, you are not drinking. You may breathe through your mouth. The room may be dry. Reflux may irritate the throat. Sinus drainage may collect. And by morning, everything feels thicker. A simple habit can help many people. Drink water earlier in the day. Do not wait until bedtime to catch up. If your doctor has not restricted fluids, start the morning with warm water before coffee or breakfast. Sip through the day. Add soups, herbal teas, and water-rich foods if they fit your diet. But do not force extreme water. If you have heart failure, advanced kidney disease, swelling, or fluid restriction, ask your doctor how much fluid is right for you. Hydration should be wise, not extreme. If you know you do not drink enough water, comment "water" below. No shame. Many people are in the same place. Cause number 5 is the gut-airway connection. This one is not talked about enough. Your throat, lungs, sinuses, stomach, and gut are not separate worlds. They communicate through the immune system, the nervous system, inflammation, and the microbiome. The microbiome is the community of bacteria living in your digestive tract. When that community is balanced, it may help regulate inflammation and immune response. When it is disrupted, the body can become more reactive. Some people with chronic mucus, throat irritation, allergies, sinus problems, or airway sensitivity may also have digestive issues, bloating, constipation, reflux, poor diet, or a history of repeated antibiotics. This does not mean your throat mucus is all in the gut, but it does mean gut health can influence airway inflammation. A diet low in fiber, high in sugar, high in ultra-processed foods, and low in fermented foods, may make inflammation worse in some people. Chronic stress can also affect the gut. Poor sleep can affect it too. This is why some people keep treating the throat, but never address the system behind it. They suck on lozenges, they drink honey, they clear the throat, they rinse the nose once. But they keep eating in a way that fuels irritation and inflammation. A better long-term strategy is to support the gut gently. More fiber from foods you tolerate, more vegetables, less processed sugar, more plain yogurt or kefir if you tolerate dairy. Fermented foods like sauerkraut or kimchi in small amounts if they fit your health needs, and better meal timing to reduce reflux. This is not an overnight fix, but long-term symptoms often need long-term pattern changes. Now, before I give you the action plan, I need to tell you when mucus should not be ignored. Most throat mucus is not dangerous, especially when it comes from reflux, post-nasal drip, dryness, or irritation. But some symptoms need medical attention. Please see a doctor promptly if you have mucus with blood, trouble swallowing that is getting worse, unexplained weight loss, a lump in the neck, persistent hoarseness, severe pain, fever, shortness of breath, chest pain, or symptoms that continue despite reasonable care. Do not try to manage those signs only with home remedies. Your body may be asking for a proper evaluation. Now let us build your simple action plan. Step 1. Stop eating at least 3 hours before lying down. This is one of the most useful steps for silent reflux. If you eat and then lie flat, stomach contents can travel upward more easily. Give your stomach time to empty before bed. Step 2. Elevate the head of your bed. Do not just stack pillows under your head, because that can bend your neck and make things worse. Use a wedge pillow or raise the head of the bed slightly if your doctor says it is safe for you. Gravity can help reduce nighttime reflux. Step 3. Start the morning with warm water. Before coffee, before tea, before breakfast, drink a reasonable glass of warm water if you are not on fluid restriction. This may help loosen overnight mucus and rehydrate the throat. Step 4. Try a safe saline nasal rinse. Use distilled, sterile, or boiled and cooled water. Do it consistently for 1 to 2 weeks. This may help post-nasal drip and sinus drainage. Step 5. Review your medication list. Write down when your throat symptoms started and what medications changed around that time. Ask your doctor or pharmacist whether any medicine may be contributing to cough, dryness, reflux, or throat irritation. Step 6. Support the gut. Reduce ultra-processed foods and added sugar. Add fiber slowly. Consider plain yogurt, kefir, or fermented foods if they are safe for you. Your gut may influence inflammation more than you realize. Step 7. Track your pattern. Is it worse in the morning? That points more toward reflux, dryness, or overnight drainage. Is it all day? That may point more toward sinus drainage, medications, hydration, or chronic irritation. Does it worsen after meals? Think reflux. Does it worsen in dusty rooms or allergy seasons? Think nasal inflammation. Does it get worse after a medication change? Bring that timeline to your doctor. Your symptoms are clues. Use them. Now let me quickly talk about popular remedies. Honey can soothe the throat temporarily, and many people like it. But it does not fix reflux, sinus inflammation, medication side effects, dehydration, or gut inflammation. Also, if you have diabetes, be careful with honey because it can raise blood sugar. Dairy does not create mucus from nothing in most people, but some people feel that milk makes existing mucus feel thicker. If you notice that pattern every time, try a 2-week reduction and see if it changes. Apple cider vinegar is popular online, but if you have silent reflux, adding acid may irritate the throat even more. Be careful. Steam may loosen mucus temporarily, but if the cause is reflux or medication, Steam will not solve the root problem. So do not ask only, what can loosen mucus? Ask, why is my body making or holding this mucus? That is the better question. Let us recap the 5 causes. Number 1, silent reflux. Acid may be reaching the throat while you sleep, even without heartburn. Number 2, post-nasal drip. Sinus inflammation may be sending mucus down the back of the throat. Number 3, medication-related irritation. Some medicines may trigger cough, dryness, or throat clearing. Number 4, chronic mild dehydration. Not enough fluid can make mucus thick and sticky. Number 5, gut airway inflammation. Poor gut balance may increase airway sensitivity and mucus response. And remember, these causes often stack together. Someone may have silent reflux at night, post-nasal drip in the morning, and dehydration making everything thicker. That is why one remedy may only help a little. You need to identify the pattern. Now let me give you a simple 7-day challenge. For the next 7 days, choose 3 things. First, stop eating 3 hours before bed. Second, drink warm water in the morning before coffee. Third, write down when your mucus is worst. Morning, after meals, all day, or bedtime. If sinus symptoms are obvious, add a safe saline rinse. If medication timing seems suspicious, schedule a medication review. If your diet is full of sugar and processed food, begin reducing it and add fiber slowly. Do not try to fix everything in one day. Start with the pattern. Start with one habit. Then watch what your body tells you. Before you leave, comment 3 things if you can. Write whether your mucus is worse in the morning, at night, or all day. Write how long you have been dealing with it. And write which cause surprised you most: reflux, sinus, medication, dehydration, or gut. Your comment may help someone else feel less alone, and it helps me know what to explain next. If this video helped you, like it, subscribe to Dr. Arthur Mark, and share it with someone who keeps clearing their throat, coughing in the morning, or saying, "I always feel mucus stuck back there." And remember this: persistent mucus is not your identity. It is information. It is feedback. It is your body asking for attention. Do not just silence the symptom. Listen to what it is trying to tell you. Start tonight. Start tomorrow morning. And give your throat the chance to finally calm down.